Hello, and welcome to the webinar titled RX for the National Diabetes Prevention Program, 3 Ways Pharmacists Can Assist in Preventing Type 2 Diabetes. My name is Rachel Blatcher, and I am a member of the National Diabetes Prevention Program team in the Division of Diabetes Translation at the Center for Disease Control and Prevention. I am joined today by several colleagues, including Lieutenant Commander Robert Montiers, pharmacist and certified diabetes educator, Rebecca Kimberlin, clinical pharmacist, Brooke Hudspeth, pharmacist and certified diabetes educator, and Farida Bana, Oak Ridge Institute for Science and Education research participant. We are excited to share this resource with you. I am pleased to acknowledge partnership and collaboration from the following National Pharmacy and Pharmacist Associations: the National Community Pharmacist Association, or NCPA, the American Society of Health System Pharmacists, or ASHP, the American Pharmacist Association, or APHA, and the American Association of Colleges of Pharmacy, or AACP. We are grateful for the insight that colleagues from these organizations have shared with us in the development of this guide and webinar. The organizations listed here have received no financial support from the Centers for Disease Control and Prevention. But first, some housekeeping. Our continuing education information. The Centers for Disease Control and Prevention is accredited by the Accreditation Council for Pharmacy Education as a provider of continuing pharmacy education. This program is a designated event for pharmacists to receive 0.75 contact hour in pharmacy education. The universal activity number is 0387 18201 H04P. This activity has been designated as knowledge-based. Once credit is claimed, an unofficial statement of credit is immediately available on TCEO online. Official credit will be uploaded within 60 days on the NABP CPE monitor. Our continuing education disclosure statement. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses, partners, wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. Planners have reviewed content to ensure there is no bias. Content will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this continuing education activity. In order to receive continuing education credit for the webinar, please visit the Training and Continuing Education online website at https://tceols.cdc.gov and follow these 9 simple steps before December 16th, 2020. Please make sure to complete the activity, complete the evaluation at cdc.gov/getce, and pass the post-test at 75% at cdc.gov/getCE. No fees are charged for CDC's CE activities. The target audience for this webinar are pharmacists and pharmacist technicians. The target audience, pharmacists and members of the pharmacy workforce, should have a fundamental understanding of type 2 diabetes. If you have additional questions, please contact the Division of Diabetes Translation at area code 770-488-1000. By the end of this webinar, you will be able to describe prediabetes and the National Diabetes Prevention Program, or National DPP, identify ways that pharmacists and the pharmacy workforce can support the National DPP within their individual practice settings, and describe ways to identify and recruit eligible participants for your CDC-recognized lifestyle change program to prevent type 2 diabetes. 30 million Americans have type 2 diabetes. However, this is just the tip of the iceberg. Today, we will be focusing on the bottom part of the iceberg, which represents Americans with prediabetes. Prediabetes is a serious condition affecting 1 out of 3 American adults. That's 84 million people. Of those 84 million adults with prediabetes, 90% of them are not aware that they have this condition, so they are not taking the right steps to solve the problem. This hidden health threat means that 84 million Americans are at higher risk of developing type 2 diabetes, heart disease, and stroke. Fortunately, we have a significant amount of evidence showing that type 2 diabetes can be prevented or delayed in those with prediabetes through a structured lifestyle intervention. The Diabetes Prevention Program, or DPP, clinical trial is the landmark U.S. study, but there have also been trials in several other countries, including China, Finland, India, and Japan. In the U.S. DPP, adults with prediabetes were randomly assigned to one of 3 intervention groups. The first, a structured year-long lifestyle change program. The second, metformin, a drug to lower blood glucose levels, or the third, a placebo group. Participants in the lifestyle arm lowered their risk of developing type 2 diabetes by 58%, 71% in those over the age of 60, compared to 31% in the metformin group. Participants in the lifestyle arm of the original DPP research trial have been followed for over 15 years now and continue to be followed. Even though they have experienced some weight regain, their reduced risk for type 2 diabetes persists, 27% in the lifestyle group compared to 18% in the metformin group. The trial in China is the longest-running study, now at 25 years, and is showing a reduction in cardiovascular events. Following the conclusion of the DPP in 2002, a decade of translation studies showed that the program could be adapted and offered in real-world settings to achieve similar outcomes at reduced costs. In response to this critical public health need and the supporting evidence, CDC began to plan how to implement this proven program across the country. In 2010, Congress authorized CDC to establish the National Diabetes Prevention Program, or National DPP. The National DPP is a partnership of public and private organizations working collectively to build the infrastructure for nationwide delivery of an evidence-based lifestyle change program for adults with prediabetes to prevent or delay onset of type 2 diabetes. Pharmacists play a role in this partnership as well, since they serve as a critical link between the communities they serve and the clinical sector. Let's talk in more detail about the National DPP. At its core, the National DPP is a year-long lifestyle change program in which participants work through a CDC-approved curriculum with a trained lifestyle coach and the support of their peers to make realistic and achievable behavior changes, resulting in a 5 to 7% weight loss. CDC plays a critical role in the National DPP by administering the Diabetes Prevention Recognition Program, or DPRP. The DPRP serves as the quality assurance arm of the National DPP, granting recognition to those organizations that demonstrate they can effectively deliver the program and achieve the outcomes shown to delay or prevent type 2 diabetes. The National DPP has 4 overarching strategic goals starting from the top right quadrant. First, increase the supply of quality programs. Second, increase coverage among public and private payers. Third, increase referrals from healthcare providers and pharmacists. And 4, increase demand for the program among people at risk. All of these are critical, and work must occur simultaneously in all 4 areas. We believe that pharmacists and the pharmacy infrastructure have an important role to play in support of these goals. So, why should pharmacists get involved with the National DPP? Pharmacists are uniquely qualified to be a part of this program for the following reasons. 1. Pharmacists know preventive care. Pharmacists deliver preventive health care services such as administering vaccinations, assisting with smoking cessation and blood pressure control, and delivering diabetes self-management education and support. The National DPP Lifestyle Change Program aligns with this service delivery model. 2. Pharmacists have frequent patient encounters. Pharmacists are likely to have daily encounters with patients with prediabetes who are unaware of their condition or their risks involved. Pharmacists may be able to reach populations who are underserved by providing services in areas where gaps exist due to lack of clinical or community resources. And 3, pharmacists are an essential part of today's healthcare system. Pharmacies are expanding their portfolio of patient care services and ultimately seek to achieve better health outcomes for their patients. For these reasons, pharmacists are well positioned to play a role in the National DPP. As such, we developed this resource titled RX for the National DPP, Action Guide for Community Pharmacists. The Action Guide was written for the entire pharmacy workforce and is framed around 3 tiers of engagement. The 3 tiers are 1. Promoting awareness of prediabetes in the National DPP, 2. Screening and testing for prediabetes, and referring eligible patients to a CDC-recognized organization offering the National DPP Lifestyle Change Program. And 3, delivering the program in pharmacy practice sites. A pharmacist does not have to implement all 3 tiers in order to support the program. A pharmacist can choose the tier that best suits their resources and capacity. The Action Guide was designed with the following key considerations in mind. First, the guide was written to provide information tailored to the unique needs of the pharmacy sector. For example, the guide includes a workforce table with detailed descriptions of the various roles members of the pharmacy workforce, such as pharmacists, technicians, residents, and students, can perform within the 3 tiers of engagement. There are also 2 case studies written by early adopter pharmacies which provide insight on delivering the National DPP Lifestyle Change Program in the pharmacy setting. The guide was designed to motivate pharmacists to engage in the National DPP. It provides tools and tips specific to pharmacists to encourage them to get involved. Third, the guide is user-friendly and visually engaging. Throughout the development process, we solicited input from the pharmacy community. The guide was reviewed by various stakeholder groups, and it underwent user testing to validate content. We will now walk you through the guide tier by tier. Tier 1 focuses on promoting awareness of prediabetes and the National DPP. As mentioned earlier, 90% of people with prediabetes do not know they have it. Raising awareness of prediabetes and the National DPP is an important first step that pharmacists can take part in. By taking advantage of foot traffic and waiting periods within the pharmacy, Pharmacists have a unique opportunity to educate patients about prediabetes and the National DPP Lifestyle Change Program. Throughout the guide, we have included web links and resources that have information about prediabetes and the National DPP. CDC and its partners have developed many resources to promote awareness of prediabetes and the National DPP. These resources and promotional materials can be used within your pharmacy or patient care setting. This section in the guide includes links to these resources and suggestions on how to use them. Prevent Diabetes STAT was originally created by CDC and the American Medical Association, or AMA, as a rallying cry encouraging healthcare providers to screen, test, and act today. Healthcare teams can use the materials developed through this initiative to help prevent type 2 diabetes by referring patients to CDC-recognized organizations offering the National DPP Lifestyle Change Program. STAT resources are available at www.preventdiabetesstat.org. The National Prediabetes Awareness Campaign is a partnership between AMA, CDC, and the Ad Council. It features a humorous approach to a serious topic. Audience members are directed to an interactive website where they can take a prediabetes risk test and learn more about type 2 diabetes prevention. The campaign includes public service announcements in the form of posters that pharmacists can print and display or videos that can be embedded in digital newsletters, emails, and other online communications shared with customers and patients. Finally, CDC partnered with television network CBS on a campaign that features award-winning journalist Joan London discussing prediabetes and diabetes in mini interviews with leading CDC and medical experts. The interviews are presented in 2 to 3 minute segments on CBS television stations. The campaign also features 30-second spots that pharmacies can buy and customize with their own logo and call to action. This can include directing viewers to visit their website or call a local phone number. Video segments can also be placed on a pharmacy's website, on mobile devices using geofencing technology, or on televisions in doctors' offices. Using the Tier 1 materials in your pharmacy setting from the 3 promotional campaigns is simple and straightforward. Print materials can be displayed on bulletin boards or walls in the pharmacy waiting room or any area with heavy foot traffic, given to patients who are picking up medications or used as bag stuffers when distributing medications. Digital materials can be used on televisions, computers, or tablets within your pharmacy. Any of the promotional materials provided in this guide can be shared on social media to promote the National DPP. Consider posting these materials on special dates such as Diabetes Alert Day, the 4th Tuesday in March, or World Diabetes Day, November 14th, or during Diabetes Awareness Month, November. You can also follow CDC Diabetes on Twitter at CDC Diabetes and Facebook, CDC Diabetes, for diabetes-related updates and information. Consider retweeting or sharing these posts with your followers. And now, a knowledge check. True or false? The National DPP Lifestyle Change Program is based on the science of the Diabetes Prevention Program research trial, which showed that making realistic behavior changes helped people with prediabetes lose 5 to 7% of their body weight and reduce their risk of developing type 2 diabetes by 58%, 71% in those over age 60. The answer is true. The National DPP is based on the science of the Diabetes Prevention Program research trial and many subsequent translation studies. Now I'm going to turn things over to Robert Monteith, who will walk us through Tiers 2 and 3 of the guide.
Thanks, Rachel. Next, we move into tiers 2 and 3 of the guide, where we describe how pharmacy staff can get involved in identifying patients with prediabetes and referring those patients to the National DPP Lifestyle Change Program, or to offer the program through their pharmacy. Screening for prediabetes is the first step pharmacists can take to determine if the National DPP Lifestyle Change Program is appropriate for their patients. In order for a patient to be eligible for the National DPP Lifestyle Change Program, the patient needs to have prediabetes or be at high risk for type 2 diabetes. Pharmacists can assess this through a simple screening process that takes approximately 1 minute. Pharmacists can easily add the screening assessment into their workflow process to start conversations with patients about risk factors and recommended next steps. The 65% of your patients who are eligible for the Lifestyle Change Program can enroll based on the results of a CDC-approved risk assessment test. There are 2 CDC-approved risk assessments, one developed by the American Diabetes Association and one by the CDC. Both risk assessments consist of a short list of questions and can be completed quickly. Pharmacy staff can utilize pharmacy wait times to administer the risk assessment and should consider giving the test verbally when possible instead of asking patients to complete it online or giving them a paper copy to fill out. This approach may help establish a connection with patients and make it easier to personalize your recommendations. The risk assessment typically takes about 1 minute to complete, and elevated scores determine if a patient is at risk for type 2 diabetes. A blood glucose test is encouraged for any patient who scores high on the risk assessment. A blood glucose test is another way to determine if a patient is at risk of developing type 2 diabetes. With the wide variety of pharmacy settings that exist, blood glucose tests may be more feasible in some pharmacies than others. If you cannot offer a blood glucose test, refer patients with a high score on the paper or online risk assessment to a clinical partner or to the patient's primary care provider for confirmatory blood glucose testing. While up to 65% of participants can enroll in the National DPP Lifestyle Change Program based on the eligibility results of the screening assessment, a minimum of 35% of enrollees must have a blood glucose test result in the prediabetes range. A blood glucose testing process is something your pharmacy is able to do. The blood glucose result must be in the ranges for one of the following tests: a hemoglobin A1C of 5.7 to 6.4%, a fasting plasma glucose of 100 to 125 milligrams per deciliter, or a plasma glucose of 140 to 199 milligrams per deciliter 2 hours after a 75-gram glucose load. These values are highlighted in red. People who screen in this range are eligible for the National DPP Lifestyle Change Program and should be referred to a CDC-recognized organization and their primary care provider for follow-up. When screening patients with a risk assessment test or administering blood glucose testing, you will identify patients with prediabetes. Use this opportunity to apply elements of motivational interviewing, goal setting, problem solving, and cultural sensitivity to guide patients toward enrollment in a CDC-recognized organization offering the National DPP Lifestyle Change Program. When patients are found to be at high risk of developing type 2 diabetes based on the results of a risk assessment or an elevated blood glucose level in the prediabetes range, please refer them to their primary care provider and a CDC-recognized organization offering the National DPP Lifestyle Change Program. If possible, inform the patient's primary care physician about screening or blood glucose test results so the diagnosis can be confirmed, documented, and managed. refer patients to a nearby primary care provider if they do not have one of their own. Establishing relationships with one or more National DPP lifestyle change programs in your community or online can be helpful to facilitate a referral process. CDC-recognized organizations in your area can be found on the CDC's National DPP website, where you can search program locations by zip code. A list of online programs is also available on the CDC's National DPP website for those who prefer to take the class online. There are also programs offered through a combination of these modalities and via distance learning. In order for an individual to be eligible to participate in the National DPP Lifestyle Change Program, he or she must meet the following qualifications: be at least 18 years of age and, if female, not pregnant at the time of enrollment, and have a BMI of greater than or equal to 25, or if Asian, a BMI greater than or equal to 23. In addition to those qualifications, participants must also have a blood glucose reading in the prediabetes range or a high-risk score on the ADA or CDC risk assessments indicating prediabetes. If a woman has a history of gestational diabetes, that qualifies as well. The last box is specific to Medicare beneficiaries. The Medicare Diabetes Prevention Program, which you will hear about more in a few minutes, requires a blood glucose level in the prediabetes range. If a plasma fasting glucose is used, the result must be between 110 to 125. Hear from a pharmacist who has experience implementing Tier 2 screening, testing, and referring.
Hi, I'm Becca, and I'm a pharmacist at a critical access hospital in rural Nebraska. I facilitate a CDC-recognized diabetes prevention program alongside a dietitian and fitness instructor at our facility. When we started our program, we brainstormed how we could make our program successful. We wanted to ensure we had several participants in our first class, so we would have plenty of data to submit to CDC for recognition. So we decided to go out into the community and find participants. Screening takes very little time and is really easy once you incorporate it into your workflow. Since I work in a hospital pharmacy, I do not have as much face-to-face contact with patients that a retail drugstore pharmacist would have. But we were still able to find plenty of opportunities to screen for participants. We spoke about the program we were offering at several community events. On these occasions, we handed out the paper-based risk assessments. Now think about this. If we just handed out these risk assessments or hung the assessment on the doctor's office walls and bathroom stalls without telling people what to do with their results, they would be scared about their risk for prediabetes. They would also have no idea what to do with this information. It was very important that we talked people through the risk assessment and followed up on the next steps, which are testing and referring. When someone who took the risk assessment had a high risk score, we had a form ready for them to take to their doctor's office that talked about the results we found in the program that we offer, as well as an application for the patient to fill out to enroll. We screened at health fairs, women's fairs, and the county fair, and met with local businesses that were interested in offering to pay for the program as part of a wellness benefit. Some employers asked us to speak during their employee lunch hours, and we screened and educated at our local senior diners club. At many of our screening events, we had the opportunity to offer finger stick glucose tests. Something that surprised me at these testing sites was the number of people who got excited about a free finger stick. There were very few people who passed by without taking the opportunity to have their blood glucose tested. We always have cards available to write the date and the blood glucose reading on, as well as a checkbox for whether the reading was fasting, postprandial, or random. These cards also have our contact information on them so that the patient or their provider can contact us regarding our program. Our facility offers a discounted lab panel once a year for community members who may be uninsured, underinsured, or who just want to get labs done and know exactly what they're going to pay. Something we plan to incorporate into the panel is information about our National DPP Lifestyle Change Program. Since the labs are done on an outpatient basis, many people do not know what to do after they receive their results. We plan to include information on our program and on what someone should do if their results are in the prediabetes range. Screening, testing, and referring all go hand in hand. At each of our screening events, there are frequently opportunities to test. And if a person is at risk for type 2 diabetes or has prediabetes, we always have a referral ready. When referring a person, we talk to him or her about what our program entails to gauge their interest. We provide a pamphlet or form with information for their doctor about the program as well. If the person is interested in learning more, we have them fill out the application for the program. This application includes basic demographic information, the risk assessment if they haven't already completed it, and a minimal health history. This serves as great information when it comes to doing follow-ups for our introductory section.
Thank you, Rebecca. We now want to take a moment for another knowledge check. Which of the following criteria would qualify an individual to participate in the National DPP Lifestyle Change Program? A, they are 38 years of age. B, they have an A1C of 6.5%. C, they have a BMI of 27. D, all of the above. E, A and C only. The correct answer is E, A and C only. An individual must be at least 18 years of age at the time of enrollment, which was choice A. And choice C, they must have a BMI greater than or equal to 25, or if Asian, a BMI greater than or equal to 23. C is incorrect because the A1C range for prediabetes is 5.7 to 6.4. A1C of 6.5 is within the diabetes range, and the patient should be referred to a primary care provider for a confirmatory diagnosis, as well as diabetes self-management education, support, and treatment. We now want to move into Tier 3 of the Pharmacy Guide, which describes how pharmacists can implement the National DPP Lifestyle Change Program within a pharmacy setting. A few of the reasons why the pharmacy workforce should consider delivering the National DPP Lifestyle Change Program are, first, applying for CDC recognition is free. Not only that, the Prevent T2 Lifestyle Change curriculum and supporting materials are also available at no cost. Second, pharmacies are increasingly a source for preventative health support. There has been great success in offering immunizations and smoking cessation support in pharmacies. Third, there are a growing number of employers and insurers, both public and private, that reimburse for the National DPP Lifestyle Change Program, providing an additional source of revenue for pharmacies. If you decide to deliver the National DPP Lifestyle Change Program, you will need to submit an application to become a CDC-recognized program delivery organization. All of the information you will need for this process is available on the National DPP website. The Diabetes Prevention Recognition Program, or DPRP, is the quality assurance arm of the National DPP. DPRP uses a set of national quality standards to ensure that the program is implemented in a way that maintains fidelity to the evidence on which the program is based. Before your organization submits an application to deliver the National DPP Lifestyle Change Program, Please become familiar with the DPRP standards and complete the capacity assessment that is also available on the website. Once your organization receives pending recognition status from the DPRP, you may begin offering the Lifestyle Change program. Now we're going to hear from Brooke, a pharmacist who works with a grocery retail pharmacy that is currently implementing the program.
Thanks, Rob. I am going to share our experience implementing the National DPP Lifestyle Change program at a Kroger store in the Louisville division in Kentucky. In 2014, Kroger's Louisville division in Kentucky received funding from the American Association of Diabetes Educators, or AADE, as part of AADE's effort to help set up new CDC-recognized organizations in areas where diabetes self-management education and support programs already exist. AADE support helped the Louisville division develop its program, train lifestyle coaches, give scholarships to participants, and develop an infrastructure for long-term sustainability. The staff are confident that they could deliver the program because of their familiarity with third-party payment processing, their strong connections with local primary care physicians, their knowledge of the type 2 diabetes risk continuum, and their experience managing personal health information. Sessions are typically held in Kroger grocery stores, which is convenient for most participants. The setting also enhances lessons on healthy food options because of the opportunity for cooking demonstrations and shopping tours. Sessions are held in conference rooms to incorporate physical activity components. The lifestyle coaches who teach the program are CDEs, RDs, and PharmDs. In the future, some will be certified pharmacy, nutrition, and patient care technicians. A PharmD has typically served as program coordinator in the past, but this role will soon be filled by CDEs, RDs, registered nurses, and advanced registered nurse practitioners, or ARNPs. To ensure the success of its efforts, the Kroger Health Model has employed an innovative program that uses both in-person group sessions and online sessions to make the program more accessible and retain participants. Collaborates with dietitians and ARNPs to give participants more resources and improve their overall experience. Offers the program across a large number of stores to make it more accessible for more participants, and uses licensed health professionals to oversee the technicians who deliver the program in case complex clinical issues arise or referrals are needed. Rob, back to you.
Thank you, Brooke. We now want to take a moment for another knowledge check. The following statement true or false? Pharmacies may begin conducting classes once they receive pending recognition from CDC. The correct answer is true. Once your pharmacy's application is submitted and accepted, you will receive notification that you have pending recognition status and can begin offering classes. Now, Farida Bana is going to describe how the entire pharmacy workforce can get involved in the program.
I'm going to describe how the entire pharmacy workforce, including pharmacists and pharmacy technicians, residents, and students, can be involved in supporting the National DPP's mission to prevent type 2 diabetes. This table describes which members of the pharmacy workforce are best suited for the 3 tiers of engagement. All of the members of the pharmacy workforce are well suited for Tier 1, promoting awareness of prediabetes and the National DPP. For Tier 2, screening, testing, and referral, pharmacists, technicians, and residents are best suited. Finally, for Tier 3, implementing the program, technicians are likely the best suited. This is because residents and students are usually not with the pharmacy for the duration of the program, which is 12 months. Pharmacy technicians are a more cost-effective option than pharmacists. I am now going to share with you two exciting developments with the National DPP. The first is Medicare coverage of the National Diabetes Prevention Program. This coverage is called the Medicare Diabetes Prevention Program, or the MDPP, which is not a separate program from the National DPP, but part of it. As mentioned earlier, the Medicare Diabetes Prevention Program, or MDPP, expanded model launched earlier in 2018, making the National DPP Lifestyle Change Program available as a covered service for enrolled Medicare Part B beneficiaries with prediabetes. The MDPP expanded model resulted from the Center for Medicare and Medicaid Innovations test of the YMCA's Diabetes Prevention Program model delivered to Medicare beneficiaries across 8 states. Data from the CDC's Diabetes Prevention Recognition Program and a large commercial health plan participating in the National DPP were also used for CMS actuarial certification. Results showed a cost savings. Because of these positive results, the model was expanded, and the Medicare Diabetes Prevention Program officially launched in April 2018. In order to enroll eligible Medicare beneficiaries and receive reimbursement from CMS, organizations must first have CDC preliminary or full recognition and apply to become MDPP suppliers. To learn more, please visit the MDPP website at the link shown on the slide. Next, an exciting resource was launched in October 2018. The National DPP Customer Service Center is a centralized hub for training and technical assistance for CDC-recognized program delivery organizations and other national DPP stakeholders across the country. On this hub, organizations can find relevant resources, engage with subject matter experts for assistance, and share feedback and success stories. Visit the National DPP Customer Service Center at nationaldppcsc.gov. Now we would like to share responses to some frequently asked questions. Is the guide a resource for all pharmacists? Yes. This guide can be used by pharmacists in a community setting, a health system, or a retail or grocery store setting. Is prediabetes really a serious health condition? Yes. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. Prediabetes puts you at an increased risk for type 2 diabetes, heart disease, and stroke. Are there efforts to get more payers to reimburse for the National DPP Lifestyle Change Program? Yes, there are currently many efforts underway to expand coverage for the National DPP Lifestyle Change Program. As I mentioned a minute ago, the Medicare Diabetes Prevention Program is available as a covered service for eligible Medicare beneficiaries. As of October 2018, 19 states offer coverage for state or public employees, and over 100 commercial health plans and employers cover the program as well. Finally, a growing number of state Medicaid agencies include the National DPP Lifestyle Change Program as a covered service for their eligible Medicaid beneficiaries. To learn more, please visit the National DPP Coverage Toolkit at coveragetoolkit.org. We have included a list of some of the resources and web links that we have described throughout the webinar. I will review these briefly. First, a link to RX for the National Diabetes Prevention Program, Action Guide for Community Pharmacists, where you can read all about the National DPP and the 3 tiers of engagement. Next, the National Diabetes Prevention Program's website is a great place for information about prediabetes and the National Diabetes Prevention Program. The National DPP Customer Service Center is a resource for knowledge articles and a place where you can receive technical assistance in delivering the program. The Diabetes Prevention Recognition Program standards are the standards by which CDC-recognized organizations implement the National DPP Lifestyle Change Program. The Medicare Diabetes Prevention Program Expanded Model website has information about the MDPP benefits, eligibility, and reimbursement requirements. Finally, the National DPP Coverage Toolkit goes into detail about how the National DPP Lifestyle Change Program can be covered as a benefit and includes sections on Medicare DPP, Medicaid, employers, and commercial payers.
Thank you, Farida. If you work in the pharmacy space and are interested in getting involved with the National DPP, here is your call to action. You can support Tier 1 by promoting awareness. Educate your patients and colleagues about prediabetes and the National DPP. Tier 2, screen, test, and refer. Screen and test patients for prediabetes. Refer eligible patients to a CDC-recognized organization providing the National DPP Lifestyle Change Program near you. And Tier 3, if you have the capacity, deliver the program. Apply for CDC recognition to deliver the National DPP Lifestyle Change Program in your pharmacy. Together, we can help people prevent type 2 diabetes. Thank you very much for your interest and participation. This concludes